Welcome to a fascinating journey through the intricate world of human anatomy. Today we are going to discuss one of the most well-preserved secrets in a woman's body, which is the Douglas pouch. The Douglas pouch, also known as the vaginal fornix or uterine rectum, is a somewhat discreet cavity located in the female pelvis. But why is she so intriguing? Well, it is precisely because of its strategic location and its various functions that make it worthy of our attention. Throughout this video, we will discuss the depths of human anatomy, exploring the different structures that constitute the Douglas pouch and its connection to gynecological health. From its importance in evaluating conditions such as endometriosis to its fundamental role in gynecological surgery, the sac de Douglas is a key piece that deserves to be shown, unveiled. I am Dr. Jose Marcos Neves, creator of this channel. Before discussing the video's topic, I want to remind you that registrations for the Map of Intimacy, our course, are closed. You can sign up for the wait list for the third session of the Map of Intimacy, my course on sexuality, in which I strive to empower young women who are looking to rejuvenate their sexual experiences and improve their intimate relationships. All of this comes with monitoring and a support team that answers all of the students' questions. If you wish to register for notifications prior to the opening of the next class, please click on the link provided in the description to join the silent group. And that's how we'll inform you when we'll open the new course, the new class. The Douglas pouch or Douglas CUL-DE-SAC, also known as the vaginal cul-de-sac or uterine rectum, is a cavity in the female pelvis between the uterus and the rectum. This area, called in tribute to British surgeon James Douglas, has a significant function in the fields of anatomy and gynecological health. The Douglas pouch is a bag-shaped depression in the female skin. It is positioned posterior to the uterus and anterior to the rectum, thus forming a triangular cavity in the pelvic region. The structure of it is composed of connective tissue and is lined by visceral peritoneum, which provides a smooth and slippery surface for it. The Douglas pouch facilitates mobility of the uterus, enabling movements during both the menstrual cycle and the period of pregnancy. Your presence also facilitates vaginal delivery, providing space for the baby to pass through. The manual gynecological examination can detect abnormalities in the Douglas pouch, such as the presence of free fluid indicative of conditions such as endometriosis, cancer, ovarian cyst, or even recent ovulation. Having access to the pouch of Douglas is absolutely vital in gynecological surgical procedures such as hysterectomy, oophorectomy, and surgeries aimed at treating conditions like endometriosis or ovarian cysts. One of the conditions most associated with Douglas pouch is endometriosis, in which the endometrial tissue grows outside the uterus, often affecting this region of the pelvis from behind. The buildup of fluid in the Douglas pouch can indicate the presence of ascites, a condition that can be caused by various factors such as heart failure, liver cirrhosis, abdominal cancer, or infections in the abdominal area. Speaking about ovarian cancer, the presence of fluid in the Douglas pouch can also be an indicator of ovarian cancer, especially in women with suspected malignancy. Physical examination and pelvic ultrasound are frequently used methods for evaluating the Douglas pouch. In the physical examination, the doctor can palpate the vaginal fornix in search of abnormalities. Vaginal ultrasound is a procedure that can provide more detailed images of the pelvic cavity, assisting in the diagnosis of conditions such as endometriosis or ovarian cysts. When the Douglas pouch ruptures, and it can rupture in different situations, the most common of which is, for instance, abdominal trauma, severe trauma in the abdominal region, it can lead to this outcome. As in a motorcycle accident, for example, a fall hitting the abdomen can cause rupture of the sacrum due to direct impact on the pelvic cavity. During surgical procedures in the pelvic region, such as hysterectomy or oophorectomy, the SARS-CoV-2 virus can be unintentionally punctured, resulting in its rupture. In cases of endometriosis, the presence of endometrial tissue outside the uterus as in SARS-CoV-2, can lead to the formation of adhesions and eventual rupture due to chronic inflammation. Regarding complications in pregnancy, in rare cases, these complications such as placenta previa or uterine rupture can also result in the rupture of the Douglas pouch. And how does the Douglas pouch rupture? The sac usually ruptures due to a sudden increase in pressure in the pelvic cavity, resulting in a tear in the wall of the Douglas pouch, an anatomical structure found in the female reproductive system. This can cause intense abdominal pain, vaginal bleeding, and in severe cases, hypovolemic shock due to blood loss. Why does the Douglas pouch rupture? The causes of Douglas's pouch rupture vary, but they are usually related to excessive pressure in the skin cavity, trauma, surgery, diseases with endometriosis, and also complications of pregnancy are well-known risk factors in obstetrics. The existence of adhesions or scar tissue can additionally amplify the risk of rupture during surgical procedures. Douglas's sartor rupture can cause serious complications like internal bleeding, abdominal infection, peritonitis, and abscess formations in the mirror, for example. The usual course of treatment typically involves surgical intervention to repair the tear and control any bleeding if it is present. The rupture of SARS-CoV-2 is a serious event that can occur in various situations, including trauma, gynecological surgeries, diseases with endometriosis, and it is important to recognize the signs and symptoms of a rupture in order to seek treatment as soon as possible. Understanding the causes and consequences of this phenomenon is crucial to ensure an appropriate approach and prevent serious complications, often leading to death. As a gynecologist, it is my duty to highlight the potential risks associated with wild sex in relation to the Douglas pouch. A delicate structure of female skin. During more vigorous sexual activities, Douglas's wise man can be subjected to excessive pressures and abrupt movements, increasing the risk of injuries. Douglas's wisdom fund is situated in the area between the uterus and the rectum, and any direct impact or vigorous movement during sexual intercourse can result in a rupture occurring. A laceration in Douglas's pouch can result in internal bleeding, intense pain, and even serious complications such as peritonitis or the formation of a pelvic abscess, and often even death, the Polvoleb shock. It is essential to practice sex with care and respect the limits of the body. Open communication with your partner, using appropriate lubricants, and avoiding sexual positions that may exert excessive pressure on the pelvic region can help reduce the risk of injury to the scrotum. In the event of severe pain, bleeding from the vagina, or any other worrisome symptoms following sexual intercourse, it is crucial to promptly seek medical attention for evaluation and the necessary treatment. Prioritizing safety and well-being during sexual activity is essential to preserve the health of Sartor Douglas and avoid potentially serious complications. The Sartor Douglas is an anatomical structure of crucial importance in female skin, playing fundamental roles in uterine mobility, diagnosis of gynecological conditions, and gynecological surgery. A deep understanding of this structure is essential for gynecologists in the diagnosis and treatment of various clinical conditions. The Sartor Douglas, despite its description, unveils itself as an essential component of the female reproductive system, highlighting the complexity and significance of human anatomy. We're close to the end of this exhibition, which was fascinating in my opinion, about the Douglas pouch, an essential yet enigmatic anatomical structure of the female skin. We trust that every word has been a source of illumination to uncover the enigmas of the triangular cavity and its significance in gynecological well-being. Our journey does not need to conclude at this point. Subscribe to our channel to gain access to exclusive content where we will persist in revealing the mysteries of anatomy and women's health. The hyperlink is right there, prepared to direct you on an even more profound voyage of understanding. Do not keep this knowledge solely to yourself. Share it with your friends, because by working together, we can promote a greater awareness of the significance of gynecological healthcare. Every share is a stride towards a healthier and more knowledgeable community. We thank you for accompanying us on this journey of discovery, learning, and studies. May the knowledge obtained be a companion on your journey towards well-being and your complete health. Sign up now. Continue exploring the fascinating world of female anatomy. Don't forget to share this video too. Spread knowledge and promote gynecological health. My wonderful friend, if you enjoyed this video, please share it with your friends, give it a like, subscribe, and help us grow this channel. I count on you. Also check other videos on our channel. Don't forget, there are crucial subjects and topics here. Now I'm leaving. Until the next video, a big kiss. Thanks.